from Ghana. My name is Samuel Kekeli Agordzo. I am a research assistant with Michael Frimpong, Dr. Michael Frimpong at KCCR. I also work with Dr. Samuel Asamoah Sechi in KNUST. Primarily, I'm involved in clinical sample collection from our study sites. So we work from Kumasi South Hospital. We also take samples from Obuasi, as Anglo-Good Ashanti. We have samples from KCCR. So we work on samples from these testing facilities. So I obtain these clinical samples back to the lab where we are stationed and then perform a testing. So these clinical samples already come in the form of extracted RNA. So all I have to do is to dispense them on the AfriDx chip. And we know AfriDx has a passport device which serves as a heat block and also a cartridge that contains the master mix. So when these RNA samples are obtained, I dispense them on the cartridge following the protocols, of course. There are standard operating procedures to follow. I also obtain the PCR results from the testing facilities because this will serve as our gold standard. We are going to compare the passport data with the standard results that's on the PCR machines. So comparing the two, what really happens is that in terms of user friendliness, the passport from the AfriDx is more user friendly. It does not require any complicated skills to do. So this is just to say that once you are good at handling your pipettes and able to follow protocols working with RNAs to ensure that you do not degrade your samples, you are good at working in the lab, then you can easily use the passport. And also the time taken for the passport results to be ready, it's usually 1 hour. So once you start running your sample, the machine has its own inbuilt time. So after 1 hour, the machine makes a sound indicating that your test has completed running. But if you look at the RTPCR, some take 1 hour, 20 minutes to run. And the design of the passport is in a way that the cartridge already comes with its master mix embedded in the chip. So unlike the RTPCR where the one working scientist has to prepare master mix before running the test, for the AfriDx, you already have the master mix for you. So all you need to do is to dispense a sample or the test and then you run. Huge impact because Ghana as a low and middle income country, we do not have that much resources to obtain sophisticated machines such as the RTPCR for COVID testing and other diagnosis for diseases. This is just to say that I understand that the passport system will be open in the future for other diseases, so it's not limited to only COVID. So it means that once this is rolled out on a large scale in Ghana, it will help us a lot. We will be able to deploy this to the deprived communities. You know, with the onset of COVID, we had two main testing centers, one based in Accra, one based in Kumasi, that's KCCR and then Noguchi. So samples from far away needed to be transported to these two centers. And how do we ensure the integrity of these samples before they get to testing sites? So once passport or the AfriDx is completed and we have the machines available in the country, I think it will help us a lot in ensuring that we identify and test individuals who likely may be carrying any form of disease and treat them. We treat them, and I'm sure that will save lives on time, and that certainly will also save some form of cost.